This is Career Profile 1 for Family 150. My name is Linda Dowding. I chose Family Life Education and found a career that is a behavioral health specialist at the Children's Medical Unit in Primary Children's Hospital in Salt Lake City. I spoke with, as far as a career contact, I spoke with Tom Labs Johnson, who is the director of the Behavioral Health Centralized Intake Office, and he had a lot to share with me regarding the role of the behavioral health specialist in their line staff and also in just the general reason for what they do and how they help others. The environment is a large, well-known environment. The Primary Children's Hospital is a large company, and it is a good one to be working for. It is a busy office. It's a busy place, and although it has the behavioral health specialist opportunities are within the valley, there are different places throughout the valley that you can work. This particular position, this one that's available, is a part-time one available with the CMU within the Primary Children's Hospital, and it's for 24 hours a week. This is a definition that was listed for behavioral health specialist. They provide efficient and therapeutically efficient care of the assigned specialty age group through a coordinated multidisciplinary treatment team program. Incumbents plan and teach educational activities that promote quality care and support team treatment goals, and are responsible for orienting, educating, and assisting patients with the process of their stabilization. There are some stressors. Physically, there are some requirements. There's carrying, hearing, listening, lifting, manual dexterity, pulling, pushing, seeing, sitting, speaking, squatting, kneeling, and standing and walking that are required. There's also possibilities of other things such as patience, quick thinking, stamina, and other characteristics that would be helpful in this position. There is benefits available with this position. They were not specifically listed, but they were verified that they did have them. Common tasks are to lead or assist in leading groups, which includes goal setting, educational reflections, and skills groups. They create a therapeutic personal experience with the patients as you interview to ensure a collaborative therapeutic framework that's achieved, assisting with their coping skills throughout the day and across different environments that they may be in. Achieve treatment goals by planning and teaching various skill building and other activities within groups. Use organizational and communication skills to maintain consistent care among the staff by communicating pertinent patient information in your staff reports and to the treatment team. Using knowledge of behavioral intervention, including level system, timeout, and seclusion, to implement individual patient programs to provide consistent patient care. And maintain timely and accurate patient care forms, identifying critical situations and managing those situations with sound judgment and problem-solving skills to prevent escalation of the situation or injury to clients or staff. With treatment issues and behavioral interventions, use your knowledge of behavioral health treatment and programs to educate parents and families to ensure parents and families receive all their pertinent information to improve the outcome. Educational requirements are Basic Life Support Certification, or BLS, for healthcare providers. Pediatric-based behavioral health specialists at Primary Children's are required to have food handler permits. 2 years post-high school education in social work, sociology, psychology, or family studies or health science field. 2 years of experience working as a CNA or an EMT, or bachelor's degree with 6 months of experience working with psychiatric or chemically dependent patients, or 2 years of experience working with psychiatric or chemically dependent patients. Basic computer skills, excellent verbal skills and written skills with the ability to communicate on a professional level. Preferred requirements are bachelor's degree in social work, sociology, psychology, or family studies. 6 months prior experience working with psychiatric or chemically dependent patients. 6 months prior experience working in a pediatric behavioral health care setting. The salary, entry salary begins at $13.40 an hour. The experience salary was not listed, and Tom didn't know that answer when I requested it from him. Some additional information. When I spoke with Tom, he referred to the importance of the line staff and how they, as behavioral health specialists, they work with the individuals and dealing with their challenges. And some of these clients are within the system. They're there Monday through Friday, 8 to 5, and then go home on evenings and weekends. These are the clients themselves. And he indicated that the specialists, as they interact with these children, sometimes are available when there are challenging situations, such as when they get off a phone call from a parent and need to have a place of safety, or they may be in a group session, come out of that, and have dealt with some tough things while they're in that, and have a safe place to communicate. And so these behavioral health specialists do create a level of trust and close relationships with these individuals at times that sometimes helps facilitate what the actual clinical therapists do as they interact with them in therapy. So this was a really fascinating thing to learn, and I appreciated being able to do this as my first career profile for Family 150. Thank you very much.